tests for prostate cancer. Most prostate cancers are first found during screening with a prostate-specific antigen PSA blood test or a digital rectal exam DRE. If your doctor suspects you might have prostate cancer, he or she will ask you if you are having urinary or sexual problems. Early prostate cancers usually don't cause symptoms. The actual diagnosis of prostate cancer can only be made with a prostate biopsy, digital rectal exam or DRE test. During a DRE test, your doctor inserts a gloved, lubricated finger into your rectum to examine your prostate, which is adjacent to the rectum. The prostate is just in front of the rectum. Prostate cancers often begin in the back part of the prostate gland, which might be felt during a rectal exam. This exam can be uncomfortable, but it usually isn't painful and only takes a short time. Although DRE is less effective than the PSA blood test in finding prostate cancer, but it can sometimes find cancers in men with normal PSA levels. If your doctor finds any abnormalities in the shape or size of the gland or feel for any bumps or hard areas on the prostate that might be cancer, you may need further tests. Prostate-specific antigen or PSA blood test. Prostate-specific antigen PSA is a substance made by cells in the prostate gland, both normal cells and cancer cells. PSA is mostly found in semen, but a small amount is also found in the blood. The prostate-specific antigen PSA blood test is used mainly to screen for prostate cancer in men without symptoms. Most of the men without prostate cancer have PSA levels under 4 nanograms per milliliter of blood. As the PSA level goes up, the chance of having prostate cancer goes up. The PSA level usually goes above 4 when prostate cancer develops. Still, below 4 level does not guarantee that a man doesn't have cancer. About 15% of men with a PSA level below 4 will have prostate cancer on a biopsy. Those men who have a PSA level between 4 and 10 have about a 1 in 4 chance of having prostate cancer. Having PSA level more than 10, the chance of having prostate cancer is over 50%. With a high-level PSA, your doctor may advise either waiting a while and repeating the test, or getting a prostate biopsy to find out if you have cancer. Not all doctors use the same PSA cutoff point. Some doctors may advise it if the PSA is 4 or higher, while others might recommend it starting at a lower level, even when level is 2.5 or 3. Many other factors, such as your age, race, and family history, may affect your doctor's decision. Factors affecting PSA levels. There are a number of factors other than prostate cancer that can raise your PSA levels. An enlarged prostate. A non-cancerous enlargement of the prostate that affects many men as they grow older can raise PSA levels. Older age. As you get older, PSA levels normally go up slowly, even if you have no prostate abnormality. Prostatitis. Inflammation of the prostate gland, which can raise PSA levels. Ejaculation. Ejaculation can make the PSA go up for a short time, and then go down again. That's why some doctors suggest to abstain from ejaculation for a day or 2 before testing. Riding the bicycle. Cycling may raise PSA levels perhaps because the seat puts pressure on the prostate, although not all studies have found this. Certain urologic procedures, the prostate biopsy or cystoscopy, can result in higher PSA levels for a short time. Moreover, some studies have suggested that a digital rectal exam DRE might raise PSA levels slightly. Certain medicines. Taking male hormones like testosterone or other medicines that raise testosterone levels may cause a rise in PSA level. Factors lowering PSA levels. On the other side, some factors might cause PSA levels to go down even if a man has prostate cancer. 5-alpha reductase inhibitors. Certain drugs used to treat BPH or urinary symptoms may lower PSA levels. Tell your doctor if you are taking these medicines because they may lower PSA levels. Herbal mixtures. Some dietary supplements may also mask a high PSA level. So let your doctor know if you are taking any type of supplement. Obesity. Very overweight men often tend to have lower PSA levels. Aspirin. Men taking aspirin regularly may have lower PSA levels. This effect may be greater in non-smokers, but some more research is needed to confirm this finding. If you take aspirin regularly, talk to your doctor before you stop taking it for any reason. Statins. Some studies have linked the long-term use of statins, such as atorvastatin, lipitor, rosuvastatin, Crestor and simvastatin Zocor, with lower PSA levels. These are cholesterol-lowering drugs. Thiazide diuretics. Taking a thiazide diuretic for years is linked to lower PSA levels. Thiazide diuretics are a type of water pill often used to treat high blood pressure. Special types of PSA tests. Some doctors might consider using different types of PSA tests, but not all doctors agree on how to use these other PSA tests. If your PSA test result isn't normal, then ask your doctor to discuss your cancer risk and your need for further tests. Free PSA. In the blood, PSA occurs in two major forms. One form is attached to blood proteins, while the other circulates free and unattached. The free PSA is the ratio of how much PSA circulates free as compared to the total PSA level. The percentage of free PSA is lower in men who have prostate cancer than in men who do not. If you should have a prostate biopsy if your PSA results are in the borderline range, like between 4 and 10, then this test is used to help decide. The lower free PSA means that your chance of having prostate cancer is higher and you should probably have a biopsy. Many doctors recommend biopsies for men whose free PSA is 10% or less, and advise that men consider a biopsy if it is between 10% and 25%. Using these cutoffs detects most cancers and helps to avoid unnecessary prostate biopsies. Although this test is widely used, but not all doctors agree that 25% is the best cutoff point to decide on a biopsy. Complex PSA. This test directly measures the amount of PSA that is attached to other proteins, means the portion of PSA that is not free. Instead of checking the total and free PSA, this test could be done and it could give the same amount of information as the other tests done separately. But this test is being studied to see if it provides the same level of accuracy. Tests that combine different types of PSA. Some newer tests, such as the Prostate Health Index FI and the 4K score test, combine the results of different types of PSA to get an overall score that reflects the chance a man has a prostate cancer. These tests might be useful in men with a slightly elevated PSA level, to help determine if they should have a prostate biopsy. Psa Velocity. It is a measure of how fast the PSA rises over time. Normally, PSA levels go up slowly with age. But in some researches it is found that these levels go up faster if a man has cancer, but PSA velocity is not more helpful than the PSA level itself in finding prostate cancer. For this reason, we do not recommend using the PSA velocity as part of screening for prostate cancer. PSA density. PSA levels are higher in men with larger prostate glands. The doctor measures the volume size of the prostate gland with transrectal ultrasound and divides the PSA number by the prostate volume. The higher PSA density indicates a greater chance of having cancer. But we should keep in mind that PSA density has not been shown to be as useful as the percent-free PSA test. Age-specific PSA ranges. Even when there is no cancer, PSA levels are normally higher in older men than in younger men. A PSA result within the borderline range might be very worrisome in a 50-year-old man but cause less concern in an 80-year-old man. Because the usefulness of age-specific PSA ranges is not well proven, most do not recommend their use at this time. Transrectal ultrasound. In this test, a small probe about the width of a finger is lubricated and placed in the rectum. This probe gives off sound waves that enter the prostate gland and create echoes. The probe picks up the echoes, and a computer turns them into a black and white image of the prostate gland. This procedure often takes less than 10 minutes. Patient may feel some pressure when the probe is inserted in, but it is usually not painful. This test is often used to look at the prostate gland when a man has a high PSA level or he is an abnormal DRE result. It is also used during a prostate biopsy to guide the needles into the correct area of the prostate. It can be used to measure the size of the prostate gland, which can help determine the PSA density. Prostate biopsy. If the results of tests such as a PSA blood test or DRE suggest that you might have prostate cancer, your doctor will do a prostate biopsy. In this procedure, small samples of the prostate gland are removed and then examined under a microscope. It is usually done by a urologist, the surgeon who treats cancers of the genital and urinary tract. During this test, the doctor quickly inserts a thin, hollow needle through the wall of the rectum and into the prostate. When the needle is pulled out, it removes a small piece of prostate tissue. This is repeated several times. Most of the urologists will take about 12 core samples from different parts of the prostate gland. Though the procedure sounds painful, but biopsy usually causes only a brief uncomfortable sensation because it is done with a special biopsy instrument. The device inserts and removes the needle in a fraction of a second. Most doctors who do the biopsy will numb the area first by injecting the local anesthetic alongside the prostate gland. Ask your doctor about this local anesthetic first. You will likely be given antibiotics to take before the biopsy and possibly for a day or two after to reduce the risk of infection. After the procedure for a few days, you may feel some soreness in the area and will probably notice blood in your urine. You may also have some light bleeding from your rectum. Many men notice blood in their semen or have rust-colored semen, which can last for several weeks after the biopsy, depending on how often you ejaculate. Your biopsy samples will be looked at a microscope to see if they contain cancer cells. If cancer is seen, it will also be assigned a grade. Getting the results in the form of a pathology report usually takes 1 to 3 days, but it can sometimes take longer. Even when taking many samples, biopsies can still sometimes miss a cancer if none of the biopsy needles pass through it. This is known as a false negative result. But if your doctor still strongly suspects that you have prostate cancer either because of high PSA level or strong symptoms, the repeat biopsy might be needed to help be sure. Might be needed